Admitting to the hospital, everybody's going to have a central line placed on admission. Sometimes it's a little prior to admission if we have special testing that we need to do for chemotherapies. The central line is called a triple lumen catheter. Now, I didn't have a sample of those today, so this is a double lumen catheter, but just pretend it has one more lumen. So these are lumens, okay? And sometimes we call these pigtails, but this is going to be placed, and as you see, it comes out the chest wall, and you're going to have it in place for 3 to 4 months. So the really nice thing about having these triple lumen catheters in place is they can stay in place for much longer than 3 or 4 months if someone has needs beyond that time. The other thing that's nice about them is after they're placed initially, we're going to place a dressing over that after it's placed, and it'll be changed and taken care of, and you'll have the dressing in place for 2 weeks, and you'll cover that dressing every day with another dressing to protect it from water when you shower. But that said, after 2 weeks, we can take off all the dressing and take out the sutures and put a special little butterfly. The little white thing there is called a stat lock, and we can place that, and then it's actually open to air at that point, so you can take a shower without putting a dressing over it. So a lot of people are really excited by that 2-week mark because you can feel water and not feel a dressing there, and then we're going to give you a special swab, and we're going to teach you how to use it to clean it every day after your shower. So what are we going to give through these? We're going to give chemotherapy. We're going to draw blood. We're going to drip your stem cells through these. So these are what we need, right? But we always like to add this caveat here that we can't do everything through the central line. And Nicole is going to talk about this in a little while, but we do have to draw a certain type of immunosuppressant lab through a peripheral vein. So just know that we will have to occasionally, about once a week, draw blood from the arm. So after you admit to the hospital, you'll be seen by a provider every single day. We have physicians, we have mid-levels, but you'll see both, okay? So you'll meet a variety of people as well as your nursing team. You may be in the hospital for 4 to 5 weeks, depending on your regimen and how you're responding. I talked about a mini allo before, is if you have that really mini treatment, you may get out of the hospital as early as day +1. But again, we don't do a lot of those. We are going to give you supportive care no matter where you are. So we talk about supportive care, you know how I was talking about how when you go into the hospital, your blood counts are wherever they are. Let's say they start right here, fairly high. And then we give you chemo and or radiation, and your blood counts start to go lower. We gave you your stem cells. So the stem cells are going to go into the marrow, and they're going to be just kind of germinating there. They're thinking about showing themselves. It usually takes about 9 to 13 days for stem cells to start growing back. And so especially during that time, people are very immune compromised. So supportive care, it's to keep your environment clean, okay? So we want to help prevent infections. This is not a sterile environment, it's a clean environment, okay? So people are not in a bubble. We do like them to know that. There are times that we have to sequester patients away if there's like a public health emergency or something like that. But most of the time, people are able to have visitors unless, again, there is an event that precludes that. But while they're inpatient, they're going to get antibiotics. Everybody's going to be started on antibiotics at the appropriate time, antifungals, antivirals. They're going to get fluid and electrolyte replacement. When I say electrolytes, calcium, potassium, magnesium. We're going to take care of additional side effects because those can certainly occur. And then we kind of wait for those counts to come back in. So like I said, about 9 to 13 days for white blood cells to start coming back in. We may give you some extra shots of something that will stimulate your cells to grow. And so we see white blood cells come back first, and then we see platelets and red blood cells come back in no particular order. But everybody's going to be a little bit different. So, someone may need red blood cells for longer than someone else, or they may need platelet support longer than someone else. It just kind of depends on their journey and their biology. So we're going to move on to going into the hospital. So How should you prepare? What should you expect? So we have daily routines in the hospital, and they're pretty specific. Every day, patients are expected, and we will help you if you can't on your own, but to shower. If you can't take a shower, we want you to use antimicrobial wipes. This goes for any time people are admitted, and we would like you to continue that sort of throughout the transplant process. We are going to do daily line care, so that triple lumen catheter, every day, your nurse is going to flush these lines, probably multiple times a day. We're going to clean them, change the caps if needed. We're going to help perform maintenance, and we're going to teach you how to do it, okay? Every day you are going to do oral care. So we give you a big liter bottle of sodium bicarb, and we want you to swish and spit after every meal and before bed. That can kind of help people from getting mouth sores. And it also just makes their mouth feel cleaner, because we're going to talk a little bit more about that. Every day we want patients to get a little bit of exercise, right? We're going to really encourage you to get up and walk around your designated unit. Every day we're going to give you medications. The nursing staff, when they bring your medications, they're going to tell you what each and every medication is that you're taking, even if you say, I already know that, okay? They're going to tell you what it is. They're going to tell you what it's for. Okay, this is an immunosuppressant, or this helps prevent viruses, or this helps prevent this, okay? And then they're gonna stay there while you take it. That is not to be controlling, but we have to have you take medications in transplant at a certain time, and so your nurse is gonna make sure that you took it and that it didn't inadvertently, get swiped off the bedside table or something like that. We are also going to monitor drinking and eating. So we're going to keep a little chart in your room or right outside your room, usually right inside the room. And that's going to include like how many bottles of fluid you drank, like how many waters approximately. But we're pretty right on in these numbers. Coffee, tea, milk, orange juice. When they take your tray away, you always look at the tray and say, ate, 25% of this meal. We also monitor output. So everyone's going to have for men, a urinal, and for women, a plastic container that's inverted in the toilet, and we call it a hat, which is always sort of dubious, but it collects your waste, and we don't ever want people to feel bad about us doing that. It's what we do. We're happy to do it. We're used to it. We need to know what's going in, what's coming out, and it's important for a variety of reasons. So being inpatient, your vital signs are checked every 4 hours. So 8 a.m., noon, 4 p.m., 8 p.m., midnight, and then 4 a.m. We're going to check orthostatic blood pressures every day. Orthostatic, if you ever stand up suddenly and feel kind of dizzy, right? That means your blood pressure just went down. So we're going to check you every day for that. We're going to take your blood pressure laying down and standing up. And we want to make sure that there's not a significant difference, because we know that if someone stands up and their blood pressure falls, that they're at a higher risk for falling. And something that we really want to prevent is an injury occurring in the hospital that, again, we could have prevented. Your labs are drawn at least daily, usually at midnight, okay? People wonder why we draw labs at midnight, because it's not exactly the normal time to get up and about. You're not getting up and about. Usually, after people have their triple lumen catheter in place for a few days and they're inpatient, they don't really notice the nurse coming in at midnight. They kind of throw open their shirt and stick out their arm for vital signs, and we draw the blood, and we either turn on the lights or we don't. The nurses are very, very careful and cognizant of your preferences. If you like the lights turned on, like to be woken up and know what's going on, that's fine. Otherwise, we're very quiet and come in and say, we're taking your vital signs, we're getting your blood, just go back to sleep, and we'll be back in 4 hours. We're also going to replace the blood products and electrolytes. So when I say replace, I mean if we did those labs and we saw that someone needs a replacement of some packed red blood cells, we're going to try to do those at night, okay? Same with IV fluids that may have magnesium or calcium added in. The reason that we do that is we want you up during the day. We'd rather have these things infusing at night, and when you're mostly asleep, and then during the day, we hope that you're able to get up and go about your routine. We're also going to monitor your intake and output, which we already talked about. It's what you drink and then what is produced after you do that. We're going to perform daily weights every single day. So we have scales that are throughout our wards, our units, okay, that you can get on when you're taking your walk. But we also have scales that we bring into the room. And every day we measure your weight. The reason that we do that is we need to know if someone has a sudden increase in weight. Like sometimes people can fluctuate 5 to 10 pounds in a day, and that could be fluid that we gave them. So we need to make sure that we're not overloading your body with fluid and affecting your heart or lungs. Also, though, if someone loses a lot of weight, we want to make sure that we're replacing enough fluids that they're not getting very what we call dry. And that can also be detrimental to the kidneys. It can increase your risk for falls. And there are lots of other reasons that we're checking. Every day, your environmental services team is going to come in and clean your room. They're going to clean your room. They're going to make sure your linens are changed daily. They are specially trained on our units to clean and to clean very, very well. When we're looking at this, we want to make sure that we're cleaning at a time that is good for you, okay? So most of the time environmental services will kind of get in a routine and you'll get used to it and you'll know who they are. But if people have special needs, we can clean before or after those needs as well. What you can bring into the hospital: pictures or collages, okay, books, electronics, computers, tablets, cords for charging them, TVs and gaming equipment. We have TVs and DVDs in the rooms. And if you have gaming equipment, we do have some staff members who are able to help you get those set up. Non-skid footwear, which is important. We want to make sure that you have the proper shoes for walking around the unit. So we don't allow any bare feet, and we'll talk about that. But non-skid footwear would be like tennis shoes or shoes with any kind of like rubberized tread. We would like you to not wear Crocs on the unit. They're very slippery. So if you have, very comfy slippers that you really, really like, bring them in as long as they have that non-skid surface. Otherwise, we do have the socks that have the non-skid on them, the bright yellow, or sometimes they have blue. The other thing is if you really want hangers, bring those in with you. Games, puzzles, coloring books. In each room, and we'll show you a picture, you have your bed, you have a recliner, and then usually there's a small table with a couple chairs. And we really encourage you to get up every day and sit at that table and have your meals if at all possible. You can set up your puzzles or whatever on the table. If someone is really a puzzle fanatic, we can find them a second table. So you can bring in silk flowers as long as they don't have any decorative moss, which can harbor all sorts of things. And if you have a special blanket, like a lot of patients will bring in like a little fleece blanket that they'll have freshly laundered and they put it over their bed and it just makes it look really homey. Some people like those, some people are nope, I love these cotton blankets that you have in the hospital, which a lot of people do because we have really nice cotton blankets. So it just depends on you. We do want you to bring clothing with you. We have hospital gowns if you like, but it's recommended to bring several days worth of daytime clothes and nighttime clothes. So in an ideal world, you would have 7 days worth of daytime clothes and 7 days worth of nighttime clothes. That's a lot. So even 5, is fine. And these do not have to be like, oh, I'm getting dressed up today clothes. It's like sweatpants or a t-shirt, preferably V-necked if possible or buttoned down. We can accommodate someone if they have a higher color. It's just gonna, we just want you to know it'll just be a little trickier, but we could certainly do it. But ideally, you're getting up, you're setting a routine for yourself. You get up, you have breakfast, you take your shower, you get dressed in daytime clothes, or, whatever order that goes in, and then at night you put on clothes and go to bed. It just helps for people to create a sense of routine. Here are a couple pictures of our rooms. All the rooms don't look like this. It's just one of our rooms, as you can see, of course, a bed with a bedside table. And then in this room, there's a couch, and that's a sleeping couch for visitors, which sometimes we have visitors, but sometimes during certain seasons and when we have outbreak concerns, you will not have a visitor, but you can still have your couch. So you have a recliner, which everybody gets, okay? And then some chairs to sit up straight as well. So, I mean, the rooms they're not huge, but they're well appointed. This is just an example. As you can see, there's a television. It's a flat screen television, a closet to hang clothes if you bring a hanger, and then drawers to put your things. Things we don't want you to bring: no furniture. We have furniture. No small appliances. So sometimes people think, gosh, I really need my special little whatever, what have you, right? My toaster. And we have those on the unit. So we just want you to know that we have those things on the unit. No lamps or fans. We have a lot of lighting available in the room, and fans, we don't want anyone to have a fan because all of our units have a special airflow and they're HEPA filtered, and we have to maintain that airflow, and even a fan can throw off the airflow. No candles or odor sprays, and no visiting pets or fresh plants or flowers.